Hello, everybody, and welcome to today's webinar on health data, privacy, and security in Africa. So today is a live Q&A interactive session. I'm Joni Watson. I'm the Vice President of Marketing and Communications for the Broadreach Group. We're so happy to have so many of you here from all around the world, from, the United States, from Ghana, from Uganda, South Africa, and just about everywhere in between. We're really pleased that you have joined us. You're joining us on two different platforms, one on our Zoom platform and one on our YouTube live platform. As I said, this is an interactive Q&A session, so we'd love to get you involved. So if you have questions, and you haven't already sent them in to us, if you're on Zoom, you'll see the Q&A button in the bottom toolbar. Please click it, type in your questions, and we'll do our best to answer as many questions as possible. And if you're joining us on YouTube, then just pop it in the comments, and those will come back to me for when we get to the Q&A section. So why are we here today? So Broadreach Group is a social enterprise and really focused on health equity. We really believe and see a world where access to good health enables people to flourish. And we think that innovation and technology are one of the key ways that we can enable that dream to happen. It is Cybersecurity Month in October, so we thought this was a great time to surface some of the critical questions and discussions that we hear in the industry all the time around responsible data use. It must be said that your health data is some of your most precious private data, and it's your right for it to be private and for it to be protected. And as people that work in the global health sphere, we know that using data is incredibly important when it comes to managing an outbreak and population health. So we've heard lots of people asking questions about governance, about policy. We often get people talking to us about data residency. So where's your health data most safe and most effectively held? Is it in the cloud? Is it in an on-premise server? Those kinds of questions. And then lots of people are worried about security and compliance. So we'll cover lots and lots of ground talking about all of those throughout our webinar. But you won't be listening to me. We'll be talking with our esteemed panel. And I'm really honored to introduce them as we get going. So gentlemen, if you could put on your cameras, I'd love to introduce you all. Here you go. So first up is Dr. Vali Kleekhorn. He's from Palladium, and he is a infectious disease specialist. He has implemented programs for over 30 years around the world, and he is currently in charge of the health practice and delivering programs within Palladium. Then we have Dr. Justin Maeda, who is from Africa's CDC. He is an epidemiologist by trade, and throughout his career, he's done many incredibly interesting things. He used to head up the disease surveillance efforts for Africa CDC, and currently he'll talk a lot about it, I'm sure, later on. He is looking at and coordinating across the continent a really interesting program with the Health Information Exchange policy and standards throughout Africa and Africa CDC. So lots of interesting things that we can talk about there. And then finally, if I can introduce my colleague, Ruan Fulyun, who is the Chief Technology Officer for the Broadreach Group. Ruan has been with Broadreach for over 5 years, and he's really been instrumental in developing our strategy and implementing our technology strategy throughout the group. Previously, he was in fintech and card payments, those kinds of things. So without further ado, let's get to the questions. I had a question first for you, Ruan, which is, so why is health data and security such an issue, and why do we need to talk about it today?
Thanks so much, Joni, for creating this opportunity. I'm really excited to be covering this topic today, especially during Cybersecurity Month. I think this is an important topic throughout the year, but even more so during the month of cybersecurity, where we try and raise awareness and put the spotlight on it. I think to answer your question, and you've alluded to this in your introduction, privacy is really a fundamental human right. And, we should never forget that. And health data, being the most sensitive private data that we can store from individuals, warrants even more scrutiny and duty of care. And we just believe that we should not put individuals in a position where they have to trade their privacy in order to receive good health. So I think that's the fundamental cornerstone that we take into these discussions. The second factor, which is really external to most organizations, is that attacks on organizational data is on the rise, and that is true for all organizations, not only health organizations. And we've seen a constant rise over the last decade, year on year, in terms of the number of attacks and successful data breaches. So sensitive data that are being exfiltrated from organizations and then being sold on the black market. What is further worrying about this trend, it's not only the fact that the attacks are rising, but the fact that the attackers are quite patient to hang around in your organization and look around. So a recent study showed that on average, it takes an organization 271 days to detect that they have been breached, and then a further 70 odd days to rectify the situation. So we're looking at the better part of a year since you've been breached until you have full control over the organization. If you think about the organizational impact thereof, not only financial, but reputational, getting in the way of you delivering what you really want to do. And in most case, people on this call today, it's delivering good health to people that are in desperate need of that. It's really prudent that we try and get ahead of the attacks and not respond to them, be proactive rather than reactive. So that's the second factor. The third one, and I'll talk about this really quickly because I want to get some of our guests to elaborate on this further down the line, but this is the whole topic of regulation. We increasingly see that governments are rolling out privacy regulations, some of it quite general, covering all types of data, and some of it more specific around health data specifically. So there is a regulatory requirements that many organizations have to comply with, and the repercussions of not complying can be quite dire for organizations. So that's the scary bit, I guess. We have this burden on us to protect the data. We have the outside world trying to attack and get to the data. But we also know, as practitioners in the field, and I'm speaking now from our Broadreach experience over 2 decades of delivering health, that use of data can be instrumental in providing better health to people on the ground. We've been able to make massive advances in first-line healthcare simply by using data more effectively, unlocking the insights, and then importantly, taking the next action on the ground. And so I think the purpose of our conversation today is, how do we balance this tension? We need to keep data safe and secure on the one hand, but we do want to use the data in order to create better lives for people. And so on that note, I want to turn to Dr. Farley Cleghorn to speak a little bit and give us his perspective, working for Palladium, having implemented several health programs around the world. And I want to, Dr. Farley, focus on specifically on health consumer data in Africa. From your perspective, where are we today, and what does it mean for us?
Well, thank you, Ruan, and thanks to Broadreach for organizing this important webinar. We are in the digital age. It sounds corny. We are in the information age. We're generating terabytes of information every day, and much of that is around health. But I do want to say that it applies to all realms of human activity, and that includes the whole of society and the whole of government. We are also on a pathway towards more articulated e-government services, and that includes health. And that leads to an interaction not only between government and the consumer or the individual. And here we are not just talking about patients, we're talking about any individual, any family, any caregiver who is interacting with the health system in order to access services, receive services, and to manage and promote their own health. So we are on this journey, and we've seen how this is evolving in wealthy Western economies and wealthy Asian economies, where not only is the use of data preeminent in the services offered today, but also the individual has not just access, but control of much of that information. So the governance systems, the requirements of regulations that have evolved to control and protect consumer data have become very, very important. And many of these are compliance mechanisms, such as the General Data Protection Regulations out of the UK in 2018, the HIPAA and high-tech regulations in the United States. It aims to protect consumer data. So what is the state of this consumer data in sub-Saharan Africa? Well, many of us, as you said, are implementing large development programs, all of which are run on information. And traditionally, that information has been disaggregated, collected, rolled up, and reported. And only a small portion of it gets used. The idea of consumer health data is that the individual, the family, or the caregiver can take that information and use it to better protect, promote, and improve health. And so that leaves us in a situation where we have an evolving regulatory and governance systems or sets of systems, such as, for example, in Kenya over the last 3 months, where they have approved a broad set of regulations around data protection, including health data. We have the situation in South Africa where consumer health data is a very advanced field. It's used primarily for marketing purposes to get products and services to people. In many countries, we are in a very, shall we say, transitional state. So health data implies consumer health data imply a couple of things. One is data as a fundamental human right. Many countries are loath to use the term human rights. And part of that fundamental human right is privacy. And so the protection of privacy for your health data becomes preeminent once you assume that you have the right to your information, that you should help to control your information, and that you should use this information for your own benefit. And so this transitional state means that we need countries, not only at the level of their national authority, to adapt, understand the compliance and regulatory frameworks that are in existence already, adapt them to their own needs. But we need broader than countries, we need regional and Africa-wide agreements on how these data protect, first of all, the right to privacy as a fundamental human right, the right to health information, the right to protected health information, and setting up the guardrails and the requirements for how information is shared. So I would characterize consumer health information today in Africa is at a very variable place. Some countries are very far ahead, some countries are not. The broad availability of mobile platforms has made this actually much more important and much more urgent, because there is rapid access to health information in the hands of the consumer. Whereas in general, when we talk about development, we're talking about large data sets that have other security considerations that reside within countries and can be shared outside of countries. So consumer health data is where we are heading, and we need to be prepared, and we need to learn from the good experience and the bad experience of other countries.
Thanks so much, Dr. Farley. That was really insightful, and I think you've referenced the need for collaboration, not just within country, but also cross-border. I think that's a good segue to introduce Dr. Justin Mahida, who works for the African CDC and has seen firsthand how organizations like the Africa CDC can help to drive continental governance and policy. Dr. Mira, do you want to speak a little bit to that, specifically related to your work in the Health Information Exchange policy and standards?
Yeah, thank you. Thank you very much, Juan. And glad to be invited here to talk to this audience with the work that Africa CDC is doing, especially on the issue of data and the whole week of data security, and still the ability to be able to transmit the critical information that is needed to protect the population and attain the health security of the continent while keeping the privacy and this data security of the individuals. So this topic also comes in a time whereby we recognize the abilities of diseases and some public health threats spreading from one place to another. And this is at the juncture whereby we have an increased mobility, whereby for the recent data, it says that within 24 hours, somebody can be in all the 5 continents that are being inhabited across the world. So that kind of speed movement and ability of the same disease being transmitted across all the continent, all the different parts of the world, there must be a robust mechanism whereby the critical information to protect and safeguard the health of the individuals across the globe is maintained, but in a way that it respects human rights and it also protects the rights of people to their privacy. So as you might be aware that about 197 state parties, these are countries and territories across the world, they signed for the International Health Regulation. The current in place, the 2005 International Health Regulations that requires the state parties to share the information that is related to public health threats that has a potential spreading across borders. And within that, it's to ensure that the other state parties are protected and they get the right information to protect their population from acquiring or getting this infection. And if there's a spread, there's a way that this information is protected from them so that they don't allow the population to be affected. But the regulations as how it works also for the law enforcement, it doesn't work throughout. And also we recognize that different countries have different data protection standard, data regulation policies, etc., which becomes a bit difficult even to attain such exchange of critical information across borders. So in cognizant of that, within the African continent, where we have about 55 member states who form the African Union, and all these are in a different shape and size in terms of the ability to deal with data, collect data, process data, and report data, and also ensure that there's a data protection mechanisms put in place. As such environment, Africa CDC thought that it's good to ensure that they put a mechanism in place whereby they'll ensure that there are some standards in terms of data being collected, especially for public health events, the way it is being stored, the way it is being transmitted, and the way it is being protected. But also other standards related to the technologies that are being used, especially the current booming up of technological solutions in which each country adopts some, and that you cannot be stopping on which option that a country chose to use. But also at the same time, different countries have different policies on data regulations and regulatory policies. So looking at that juncture, I thought that it's good to we started what we call the Health Information Exchange Policy and Standard that we are promoting and ensuring that, first of all, we collectively collect all the different standards that we need to attain as countries within the continent, go through it and validate across and agree, and that these are the minimum standards each and every country should ensure that they have in terms of data, in terms of the technological solutions for data collection as well as transmission, and policies that guides on the regulation that are related to data exchange across. And then once that is done and it's agreed upon at the highest level of the political organs within the continent, then we go to the next step, that whereby we map out and assist countries to attain those minimum standards in terms of data policy as well as technological solutions. And then once that is done, then you allow such exchange to happen with less fear of breach in terms of regulation, less fear of some security exposure because of some of those probably who have not attained the minimum standard. And in that way, we allow and create a better environment that allows exchange of critical information that protects the human right and secure the health security of the continent. Yeah, so that's what I've been doing. And let me take back to you, and we'll be glad to get discusses across. Over to you.
Thanks so much, Dr. Justin. Joni, I think we're ready to take some questions from...
Okay, there are lots coming in, and we had a few emailed to us beforehand. I think that the first question I wanted to ask that was emailed to us, I think some of it potentially has been answered. So if anyone, it was to you, Dr. Justin, which is really, it seems like there's a great challenge to protect and secure data across facilities, towns, countries, and borders. So whose responsibility is it to secure that data, and who governs it?
Sure. Thank you, Joni. So the governments, especially governments who are the custodian of the rights and the human rights of the people, have the first and the primary responsibility to protect the data. But it's, as I said, it's a very complex, responsibility in terms of the protection. And this is whereby the multi-sectorial approach to such protection is key, and whereby as governments and multinational agencies like a continental agency, the UN agencies, the AU agency comes in together, they also need to ensure that they involve even different sectors, including the private sectors, the non-governmental organization, to collectively provide an input and ensuring that the protection happens. And this is because the passive mechanism whereby each and every person and each and every institution feels that it's their responsibility to protect the data of the consumers data and the data of the individual is key, then that collective efforts ensures a more sustainable way of protecting the security of the data than if you leave it as a sole responsibility of the governmental institution to do so.
Thank you. That's great. And I think that leads in really nicely to another question that's just come in. And I think, Dr. Cleghorn, you might be the person to answer that question, or to start fielding that question, which is, are there standards or policies that we can learn from other industries and from other organizations like HIPAA, High Trust, GDPR, that can really help us in Africa?
Certainly. Well, you've just mentioned three very important standards that apply to general personal information as well as health information. So the European General Data Protection Standards apply across the board. It acknowledges that we are generating huge amounts of data, all of which may pertain to individuals, and individuals should have some control over that. The HIPAA standards are really about health information protection and the transfer, transport, and communication of those data. It essentially puts the patient or the user or the client in control of that information, and it spells out the requirements for providers to provide the information on a timely basis, that is ASAP, to the consumer, particularly where the consumer is paying for services. And I think these two standards are, of course, wealthy countries with a highly developed ecosystem. And I think we always have to think about the word ecosystem. The ecosystem, if you do an ecosystem map in every country, you should be able to describe all of the components of data generation, data storage, data retrieval, and data use. And that becomes a virtuous cycle. Many countries are at different points in this journey. And yes, they can learn from each other. They can learn from both the successes and the mistakes of countries that have already trod this path. What I do think is that we need as Justin mentioned, we need platforms for sharing this progress. We need the ability for countries to be able to say, at this stage and with this ecosystem, here are the cybersecurity, data protection, and individual protection needs that we have. How do we best achieve this today? And to build in the continual improvement that is required, because this is a trend that's not going ever in the other direction unless, you know, civilization falls apart, which is possible. So we are going to be generating more and more information about every aspect of people's lives. And again, when we think about this ecosystem approach, we have to think of the different levels. Governments are responsible for storing massive amounts of information, much of it disaggregated, some of it not de-identified. Private companies, the private sector, and by the private sector, I mean not only the commercial private sector, but private sector writ large, anything that is not government. And they are generating and storing huge amounts of information. The standards and the protection of those standards need to cut across all of this. And this is a huge task. And you know, we are essentially all development practitioners. We take resources paid for by taxpayers in wealthy countries and we apply them to priority problems, including health, in countries that have needs. That generates, again, a huge amount of information. And we have traditionally not focused on the cyber security and data protection aspects of that information. Today, we have to. And just like physical security, where we all build in physical security into our work, we have to build in data protection and data security into development practice. And we have to understand the ecosystem better wherever we work.
That's fantastic. Ruan, maybe I can pull you into another question that's come in live, which is to build on to what Dr. Claire Korn has been saying. Are there currently tools that can improve data use and particularly security and compliance, particularly as you're going across borders, across regions?
Yeah, thanks, Joni. I think we are in the fortunate position that, you know, as data has become more and we're collecting more data, so as the tools that allow us to store that data securely and process it securely as well. So the technologies do exist, often in other industries. And I think, you know, one of the messages I want to deliver today is that, you know, for us in healthcare and specifically public health, you know, for those of us that work there, should really learn and observe what other industries are doing. There are some industries that have been under attack, not for the last year or two, but for decades. You know, the payments industry, as an example, you know, where I come from before working in public health, have been, you know, major targets of organized crime organizations for decades. And so they've had to adapt and respond quicker than many other industries. You know, for us in health, we can leverage many of those technologies. I'm thinking about something like tokenization, which allows us to interact with data using a token instead of the real data element. You know, so if two organizations need to exchange data to operate on that, you know, we can use that doing with tokens instead of the real elements. So if there is a data breach, that unfortunate event happens, tokens are not as valuable, or they're actually useless compared to the real data elements. So definitely there are tools available. There are other industries that are working on this problem. And so I don't think we should be looking at solving this as the public health industry on our own. We need to get together as a collective and look at what are some of these solutions that we can deploy and evolve.
Thank you, Ron. Another question that I see that's come through from Michelle Stewart, and it goes, we provide community health services through implementing partners. A challenge we are continually facing is the lack of access to data when we refer the patient in the public health system. Data protection is quoted as a reason we are not provided access to outcomes for health referrals. How do we overcome this? And what's the balance of data protection, access, and optimal health outcomes for the patient? Farley, do you want to start unpacking some of that?
Sure.
Maybe a couple of us can have a go.
That's a million-dollar question.
Yeah.
Community-based organizations provide a wonderful service in most countries where they are interacting on behalf of patients / users / families, and they're interacting with the health system in order to get better services, improve outcomes, improve health in general. So yes, absolutely an essential service. At the same time, we've just said that in the data protection standards, the unit of protection is the individual. In government, the unit of protection is systems. In the commercial arena, the unit of protection is if you sell a service, you have to provide a certain level of protection for the data that is generated. So what is the locus of control here? It's really the user, the individual. So the end game for consumer health data, and data protection is that the individual is in control, but around that locus of control are the governance and compliance systems and standards that allow this user, you or me, to feel that we can participate in this ecosystem relatively safely. Nothing is 100% safe, obviously. There are always ways that nefarious actors can influence systems and for gain. So for a CBO doing great work in, let's say, HIV, malaria, child health, maternal health, they really have to be one of the stakeholders. This is one of the issues of development. We have many, many stakeholders. And it's not just in the commercial arena, you have the provider of the service and you have the user of the service. That is where the locus of interaction is. For development, we have many, many players, and we need to engage these players in this conversation because we've said this is an evolving set of standards and compliance. This is a journey for everyone, and they need to be part of that conversation to understand how the information they need to work on behalf of their clients, to advocate and to implement, how their role is articulated within the ecosystem.
Thank you.
And maybe I'll add on to that, Joni. And another trend we've seen in the industry and where much of the pushback is coming from is that often data sharing is seen as an all or nothing. So you either have no access to the data or you have access to everything. Which, as a CTO, if someone asks me, we want to give someone access to all of the company information, I would also push back and say, there are all these regulations that prevent us from doing that. But I would really challenge people to look at what is the minimum amount of data required to perform a function. Do we need that in identified form, like Dr. Cleghorn said earlier? Or can we work with it in some aggregate form or some de-identified form, which significantly reduces the risk? And in many cases, then take that data set out of scope for these regulatory frameworks that are that are in place. Of course, it makes it harder. There's a lot more upfront discussion and planning that has to go into that. But the result and the net effect is, again, that we de-risk the data sharing to the point where if the unfortunate thing happens and data is breached, it becomes useless. And it's not this big event when a full data set is breached.
Yes, agreed. I would also like to add that because health does include certain very sensitive vulnerabilities, status, something as benign as, what's your sexual orientation in certain places is by no means benign in other places. And so I think Ruan is absolutely right. We need to understand what the data security requirements are at different levels of data, and to minimize by using standard approaches. De-identification is one of them, and allow people more access to restricted information, less access to highly sensitive information.
That's a great point. I think that takes us to another set of questions. A couple of people, I'm trying to condense some questions. A lot of people are asking about data residency. And so I thought it'd be a great time to have a discussion around that. So, where is actually the safest place to house a country's data? Is it in the cloud? Is it on-premise? And what are some of your thoughts on that? Maybe, Ruan, do you want to start? And then maybe Dr. Justin, you can jump on in.
Definitely. So the easy answer is it depends. It's not possible to say cloud is more safe than on-premise or local or vice versa. It really depends on what is the requirement. I mean, Dr. Cleghorn referred to looking at the whole spectrum of issues, not only data security, but physical security of premises and so forth. And so I think we need to look at it more holistically than just trying to pick one as the winner over the other. In some cases, when data is aggregated, de-identified, available for public consumption, there's no need to lock it down and have all the extra security measures in place because it doesn't warrant that data. A personal health record, which has all of those sensitive fields that Dr. Farley referred to, warrants a different lens to look at that. So I would encourage people to think about the cloud, local infrastructure, whether that be government or private entity, as building blocks and as a starting point and a foundation. And then on top of that, you need to layer and build out your own data systems and be comfortable that the whole stack and not just the foundation is secure. Maybe a different way of answering the question is to say we can build very secure systems in the cloud and we can build very insecure systems in the cloud, and the same for local deployments.
Sure, thank you, Johnny. And also adding to what Ruan says, I think this depends also on the capacity, and that's why it's very key to make sure that there is a minimum standard in terms of data protection that is put in place, the mechanism to protect data that is put in place, whether you're storing in the cloud or in your local servers within the country. Those minimum standards has to be attained, or otherwise there's still some risk of getting that data being exposed into such attack, and also being ending up into the hands of those who may really expose, especially the privacy of the individuals. So the need for standardization and ensuring there's a minimum a standard that are available for policy that is protecting the data, but also all those infrastructures and other mechanisms that protect the data is key. And this is one of the issues that we need to ensure, especially for data that it belongs to government, that we support governments and countries to attain that. But there's no right or wrong answer. Where is the best place to place the data?
Yes, it's just wrong ways of implementing it here.
Yeah, the other thing I forgot to mention, Joni, is that, again, people shouldn't think of cloud or on-premise or local as either or. There could be hybrid systems where you have some of it in the cloud, some of it local. And maybe the best example to illustrate this point, if you look at protecting against DDoS attacks, it's a dedicated denial of service, which is effectively some malicious organization flooding your infrastructure with traffic and effectively taking you down. So you could be offline, unable to get to any of your data or systems for days. There are really 4 or 5 companies in the world that can effectively do that today and protect against the big DDoS players and the world. So if you are saying, I'm taking everything out of the cloud and I'll just deal with it locally, you're saying that I'm going to be one of those 4 or 5 companies that will be able to protect myself against a dedicated denial of service attack. Whereas a hybrid approach may say, well, maybe I put my front door using one of the cloud providers and they provide me the DDoS protection, and then my data is layered, some of it in the cloud, some of it on-premise, some of it even in a more secure facility on-premise, according to the risk that's associated with that. The last thing I'll say there, obviously regulation is important. So in countries where there are laws in place that prevent you from taking data out of the country, those need to be adhered to. But again, there are ways to de-identify, encrypt, tokenize the data that could potentially take it out of scope for those regulations and allow you to have that hybrid approach.
Thank you.
I do think, just to finish that thought, we need more discussion of this. The sort of retreat by countries to say that no data should be stored outside their borders or even analyzed outside their borders in some countries like Saudi Arabia. This requires discussion between countries. We need development practitioners, since we're talking about health, to understand these issues and to provide technical assistance to countries to help them understand where in the journey they are, what the available options are. What we're seeing is a convergence of security standards. So, we used to talk about triple high security and, relatively low security, but now all of that is converging in ways that put burdens on developers, implementation practitioners, countries themselves. And how do we face this burden? Yeah,
absolutely. So then the next question, that's a hybrid of a few other questions, is does the real problem lie in the platforms themselves? Many international development organizations are solely reliant on open source. Is this reliance on open source platforms really the big risk?
Yeah.
I don't know if Ali, do you want to?
Sure, I'll start. My colleagues have a lot to say. Yeah, the idea is that development practitioners are operating in a space that is extremely dynamic, and we need to have agreements. So I think, the entire ecosystem of health and data needs agreement, and we haven't got to. We have guidelines, we have compliance standards, and we have practitioners, and no one is quite happy at this point. So how do we get to a place where we have agreement? And that requires a lot of hard work. It requires a lot of interaction and a lot of communication. So I'll start with that. I have other thoughts, but I'm going to let Justin and Ruan say their piece.
Well, you want to go first, or should I?
You're welcome to go, Justin.
Sure. And I think I'll also add to what Clegon has said. The major issue has been in terms of agreeing on a common standard in terms of the different different tools or tools or solutions that are being used for the handling of health data. And the policy has been the whole issue of and the complexity about agreeing on the common standards and how do we really put that has been there because of the different capacity in terms of different state parties and their ability and capacity on ensuring that if a certain standard is set, all of them can be able to build their own capacity to attain that minimum standard. So that comes with some levels of compromisation in whereby even some of those agreements that are being put in place, you have to compromise to an allowable level that most of these can fit in and can be able to attain such standards. Having said that, there is a need of ensuring that as a global community, continental organization, etc., we also invest a lot in ensuring that we build more capacities to those who cannot attain the minimum standard that is allowable to ensure such standards applies across. Pulling each and everyone together towards that journey protects everyone. So I think that's one of the key areas that all of us we need to play, and not only the governmental institutions or international organization, but also private sector and any other sectors need to come in and contribute to ensure that we attain together to have those minimum standards applied. And that way, certain things that it's an open source, it's a restricted source, once such standards are applied, will really be able to apply and assist all of us to attain such minimum standard. Back to you, Ron.
Thanks, Dr. Justin. I think the one thing I'll say is that the bad actors do not discriminate against open source or closed source. They go after all data, regardless of where it's housed. And so I think the answer here is very similar to the on-premise versus cloud debate. It's really about technology as a building block, whether that's closed or open source, and being configured fit for purpose, being maintained. I think often we think we can deploy a technology and just let it run, and it's not doing the normal hygiene that you need to do for any system that then creates the opportunities for bad things to happen. So again, I would caution people to take a definitive position between open and closed source and pick one as the winner, or declare one as more secure as the other. The reality is that can't be done. And the best is if they work in unison and you find fit for purpose use cases for each of them.
I would add that there's a dynamic tension between what people think of as open source, open platform, and proprietary solutions. And the general sort of landscape of this tension is that with open source, you can have a lot more innovation, many more players innovating parts of the system, and you have a collective approach. It's a public good approach. Whereas with proprietary systems, you can hold the producer of that system to account through regulation, expectation, user experience, complaints, help desks. And really, this is a continuous landscape. It's not 2 points in a polarity. And that's, for health in particular, we have not only the proliferation of open source, open platform, and sometimes open source, open platform, closed source. We can have all kinds of expressions. And we have a proliferation of health applications as well, particularly on mobile devices that aim to speak to one aspect of health. And how do we, put some sort of, reason around this very almost uncontrollable landscape? That is the challenge. And that's where discussion and agreement comes in. That's where minimum standards come in. That's where enforcement comes in. That's where, complaint desks, voice and accountability come in. There's so many principles of development that can be applied to digital development. So, yeah, it's an ongoing story.
Amazing. I can see that we are running up towards time. So I first would love to thank everyone that has put in so many questions. I hope that we've answered the essence of most of your questions. And then I would love to ask our panel if they could give us their parting shot, something they would like everyone to take away during the Cybersecurity Month. So Dr. Justin, would you like to go first?
Sure. So mine is one, and as we're ending up here, I would just want to highlight that the role and responsibility of data protection and ensuring there's a cyber security for all the data, especially the health data. It's a collective responsibilities. Has to do with the government, has to do with the individuals, has to do with the private sectors, and everyone who is in this industry. Collective responsibilities is the way to go, and we have to ensure that all different sector, multi-sectorial approach is applied in ensuring that the security of the data is attained without interfering the data access, availability, and use that is also essential for ensuring the health security of individuals and the population. I thank you, Juni.
That's great. Dr. Klikon, do you want to go next?
Sure. I would say to our audience that this is a journey that we will continue, to define each individual by their digital fingerprints, I'll use that word, genetic prints. The entire data set of you will continue to evolve and be filled in. So we have to prepare for that. We have to prepare for that.
Fantastic. And Ruan, do you have some passing wisdom, ending wisdom?
Thanks, Joni. Yeah, I really hope that we managed to inspire people today to tackle this challenge and not run away from the challenge. It is a hard problem, and like Dr. Klegorn said, it's not going to be solved this week or even this year. It'll be a multi-year journey. But what I would want us to keep in mind is, why are we doing this? You know, we believe that we can create a world where there's better health for people, where people can flourish. We know it's possible, doing that through the use of responsible use of data. So we do not need to compromise here. I think we can honor people's right to privacy, specifically when it comes to their health data, and give them the healthcare that they deserve to live better lives. So let's keep on the journey. Let's keep exchanging ideas. That was another theme that came through for me today. This is not one organization's problem to solve, or even one country's problem to solve. I think we need to come together as a collective and tackle this problem and stay on the journey.
Gosh, thank you so much. So well summed up. So for everyone watching, next steps for us is we're going to write a key takeaway paper, and we'll send it to you shortly, which will have a summation on lots of the questions and answers that came through. So do look out from that. And we'll also have this as an on-demand download that you can read, that you can rewatch or share with colleagues as you will. So I guess my last order of business is just to say thank you to everyone and have